So little things about the asbestosis. We know the patient is either going to be a plumber or like a miner or like an electrician or like, the shipyard worker and blah, blah, blah. And we know that it is a restrictive disease. That means FEC upon FE1 is decreased. It is decreased, so the rate would be increased, the first thing. And it is decreased in an obstructive disease and increased a restrictive disease. We also know that. We know that there's going to be a thickening of the pleura. There's going to be a Basilar Crackles. There's going to be all the shortness of breath and coughing and like digital clubbing and this is going to be decreased is carbon dioxide diffusion capacity. So what we have to remember, this would be decreased and this would be increased. Both of these would be decreased. We have the bibezitic crackers, we have the pulmonary signs, and the history is going to be something like that. And we can think of the cardiovascular causes in shortness of like the exudation, but there's going to be a JVD. There's going to be a bilateral edema. There's going to be a hepatogeneral reflex. There's going to be, a such sort of stuff. And the pulmonary pressure would be increased in case of the left heart failure. But in case of this is going to give us cor pulmonale. This is going to give us the fibrosis inside the lung. So the right side would be affected, but wedge would be increased in the left side, which won't happen in this is. So these are a few of the things that we need to remember about this, and there's going to be a linear lining. And take a Laroff course.